When you think about what goes on in an operating room, you probably think of scalpels, incisions, and stitches. Well, I'm willing to bet that the advanced, minimally invasive methods my next guest uses in the OR are not what you typically picture when you think of a physician performing an operation. Dr. Justin Weisnant, he's a neurointerventional radiologist at Baylor Regional Medical Center at Plano and Baylor McKinney. Now, he's here to tell us about some of those tiny advances that are having a huge impact in treating brain and spine conditions. Doctor, how are you today?
I'm doing well, thank you.
Let's first define your title. A lot of us have heard of a neurosurgeon, but explain what your role is with Baylor.
Well, I practice neurointerventional radiology. That's a rapidly developing field in brain and spine medicine.
Okay.
In that field, we perform procedures usually through a small incision in the groin and are able to thread small tools through the blood vessels to treat diseases in the brain, head, neck, and spine.
That's amazing. Now, I want to talk about stroke because it's one of the leading causes of death in the United States. We're talking also about long-term disability as well. So talk about the patients you see who have suffered through strokes and how you help them.
Well, there are two types of strokes, and neurointerventional radiologists treat both. The first type of stroke occurs when a clot forms and blocks blood flow to the brain. And the second type of stroke occurs when there's a break in a blood vessel in the brain and it causes bleeding. When the stroke is caused by a clot, the mainstay of treatment is to give a medicine called TPA, which circulates through the body and dissolves the clot.
Okay.
But not everyone can receive TPA, and some patients arrive to the emergency department too late to get TPA. And it's in those patients where our treatments can save lives.
Okay.
We are able to thread a small tool into the site of the clot and use another specialized device to remove the clot. We have a saying in stroke, and that's that time is brain. Mm-hmm. In many instances, we're able to perform these procedures quickly, and that can save brain cells.
Yeah, that's a big deal, and obviously there are probably so many benefits to that patient when you treat them this way and so quickly.
Yes, these procedures are minimally invasive,
right,
and they can provide shorter recovery times, fewer complications, and in many cases, better outcomes.
And you, with this technology, treat many conditions, not just stroke. What are some of those other conditions you treat?
We treat things like brain aneurysms, brain vascular malformations and fistulas, some types of vertebral fractures, as well as some types of tumors of the brain and spine.
Okay, lots of good information here, and certainly nice for those patients to hear. It's minimally invasive and saving so many lives. Doctor, thank you so much for being here today. And for more information, just call this number. It's 1-800-4-BAYLOR, or log on to baylorhealth.com/Plano. GMT is coming right back. Stay right there.